Welcome to another episode of Ask Your Doctors. We are still coming to you from our new home in the beautiful city of Durban, where there is no load shedding and when there is no winter. And today we have another exciting topic. We are talking ED, erectile dysfunction. We have with us one of our hosts. I think we are not welcoming her, she's welcoming us. She's welcoming us to the beautiful city of Durban, where we would have been broadcasting for the last few weeks throughout the rest of the winter. Doc, you are Dr. Thabile.
Yes, sir.
Dr. Thabile from the Blue Clinic in Durban. Welcome to Ask Your Doctors.
Thank you very much for having me.
How are you?
I am excited to be here. I'm feeling very good about today.
Thank you for welcoming us to your beautiful city. Now, Doc, your Blue Clinic, we're going to handle with my partner in crime. How are you, Doc? Dr. Bunolo Mashish.
I'm good. How are you?
I'm all right. How are you?
I'm good, thanks. I'm enjoying being here. The city's warm.
Are you
I love
sure,
that.
Doc?
Yeah.
Are you sure?
I am, absolutely.
You're not missing the winter?
No, I hate winter.
We stay here, Doc.
We stay here.
For as long as possible.
Yeah.
Okay, and Doc, two ladies and a guy, so I'm not gonna think much of it, but let us discuss. I believe your clinic, Doc, is a clinic that discusses sexual matters with much inclination towards male conditions.
Yes,
is
that's
that right?
true.
Or
That's
male
true.
sexuality?
Male sexuality.
Because
yes.
sexuality is not only about conditions.
Yes.
It's about pleasure too sometimes.
Most of the time.
Thank you, Doc. Oh, yes. Now, tell us, Doc, we would like to introduce you officially to our audience. And we would like to know your background. We aspire to inspire. There might be someone out there that would like to consider a career in what you do. Please tell the audience who you are, where you are from, and we've already said what you're about, but you can elaborate.
Okay. I, Dr. Thabile, born and raised in Durban, have been in Durban all my life, like all other Durban people. We never leave. I've always been here all my life, studied here. I spent most of my career in a urology department where I fell in love with male and more especially the sexual health part of male conditions. But being in state for about 15 years, it used to break my heart that we see a lot of males with erectile dysfunction and there was actually nothing much we could do for them because the government, we don't have certain medication and stuff. We always wrote scripts and we knew that our patients would not even buy those things. So I developed interest, started making an effort to attend certain courses to know more about sexuality, more especially in males, up until it got to a point where in the middle of COVID, I decided let me man up and go and start my clinic. Decision that I made last year and never regretted.
So you were trying to, you took up interest in the middle of COVID. It doesn't have anything to do with the fact that people were forever in their houses.
No.
Okay, Doc. Yeah, anyway, what's the most exciting thing about your job?
The most exciting thing about my job is actually seeing the outcome. One thing about sexual health is that most people are extremely frustrated by sexual issues. When you actually treat them and they leave and they can actually go back to their relatively normal sexual practice, it's one of the most rewarding things. You just feel like part of the family. That's one thing. The relationship I have with my patients, they feel like you're part of their family because you actually spend time in their bedroom in a way. So you feel like you're family in so many houses. So that's the most exciting thing for me.
That's really exciting and inspiring. I am inspired, really. So being someone with such a vast experience, I mean 15 years in government and now you're venturing out into your own practice, what would you say is the most common condition that you see in your clinic?
More than 80% of my patients have erectile dysfunction. Majority of males are actually struggling with erectile dysfunction, and we have this belief that erectile dysfunction is more of a condition for the older people. I tend to see quite a number of younger people that are actually struggling with erectile dysfunction, And sadly, we have a lot of beliefs around erectile dysfunction, so people don't go out and get help. They will sit at home because they believe they're bewitched by their ex-girlfriend, by the baby mama or whatever. So we see a lot of people, young people as well, with erectile dysfunction.
That's quite interesting, actually, you know, because yeah, that is the word on the street, that it's for older people. And I loved how you mentioned how, you know, you've become part of their family, and you know, you spend most of the time in their bedroom. So how did it get to that point that you developed such a relationship? I mean, for someone who's experiencing ED, it may be difficult for them to bring it up with their partner, let alone an external party, their doctor, for instance. So how is your approach, and what is the best approach in someone who's struggling and would like to seek help?
What I normally do with most of my patients is that I spend a lot of time with them. We talk, like we spend most of the first consultation is actually, I call it we get to know each other. We share, we talk about a lot of things, and before you actually present your problem and tell us what you're here for, I actually go through a number of issues that can actually, because most of the time they'll come because their erection is not hard enough. But when you start pointing out things like, are you still getting a morning erection and stuff? So I start telling them tell them a lot about the other components of erectile dysfunction. Then by the time they speak, they are more comfortable because they realize, because when they come, they think they have everything that can go wrong is wrong with them. When they realize that there's so much more that can still go wrong, they actually become more comfortable and they tend to share more.
Oh, that's interesting, yeah.
Doc, let's go back to the basics. What is erectile dysfunction and what causes it?
Erectile dysfunction basically means you are struggling to develop an erection, or you're struggling to maintain an erection, or you just don't get an erection at all. There's a lot of different things that can actually cause erectile dysfunction, but the most common cause is vascular problems. By saying vascular problems, your hypertension, your cholesterol, any condition that will actually thicken a blood vessel or make a blood vessel not flexible enough to allow blood in and out of the penis. And our second most common thing that everyone knows about is diabetes. Diabetes causes erectile dysfunction, but it doesn't. The presence of diabetes does not mean erectile dysfunction. It's actually having uncontrolled blood glucose for extended periods of time that causes erectile dysfunction. And a lot of medication, unfortunately, you go to a clinic or wherever, you get diagnosed with hypertension and you're just given a bunch of medication to start for your hypertension, but unfortunately a lot of medication. So if you are worried about your sexual health, whenever you start a medication, talk to the healthcare practitioner you're dealing with. Find out if that medication will not cause erectile dysfunction, because most of the medication that are used to treat hypertension, that are used to treat diabetes as well as depression, they cause erectile dysfunction. And neurological factors cause erectile dysfunction as well. By that we mean pelvic surgery, spinal cord injuries, and a lot of other neurological factors can actually damage the nerve to the penis, resulting in not getting or not maintaining an erection.
We'll go deeper into the causes, Doc, because the mind causes it, the emotions cause it.
Yes.
Yeah. Let's go to the warning signs. If I am at home and I would like to say, okay, do I need to have this checked? What do I look out for?
Every male must always be on a lookout if you're still getting your morning erection. A morning erection, there's that belief that goes around that morning erections are actually for the young boys. When you grow out, you outgrow it. The moment your erection in the morning is not there, you get worried, seek help. We don't mean that you must have a good quality erection or it should be as frequent as it was when you were younger. But the moment it disappears, the moment you feel like you're not getting a morning erection for an extended period of time, get worried. The moment you struggle, majority of males will struggle to get an erection now and again. It's completely normal. It doesn't mean that you have erectile dysfunction. But the moment it starts happening regularly, that you're struggling to get an erection, you're struggling to maintain an erection, then you know that you should be worried about that. And when you start losing desire, when it's time to have sex, not when there are issues, because we know there's an emotional component to it. When in the space where there is no emotional issue at home, but you're struggling to sexually perform, then you know that there's an issue.
Just a disclaimer, we are in touch with nature here. It's got its pros and cons. Something just flew into my eye, but I'll soldier on.
You thought it was excitement?
No, it's nature. Let's embrace it.
Yeah.
Oh, so now, Doc, could erectile dysfunction be related to lifestyle? by any chance?
Yes, erectile dysfunction is related to lifestyle significantly, because we know that anything that can cause vascular problems, which is actually anything that can cause heart problems, we know that smoking is one big factor in causing cardiac problems. It will definitely cause erectile dysfunction. Excessive drinking will cause erectile dysfunction. We know things like lack of exercise, because when males don't exercise, they'll tend to accumulate fat, and fat is bad for males because fat is equal to more estrogen. The more you have, your estrogen goes up, your testosterone goes down. Then it means an imbalance in hormones resulting in a low libido and erectile dysfunction sometimes.
What raises testosterone, doc?
You exercise, you take your vitamins, you take things like vitamin D, you take your folic acid. Those things will help you to raise your testosterone levels. But exercise plays a very big role, and adequate sleep as well. You must sleep your 8 hours, 8 to 10 hours every night. Your testosterone will go up.
Is it reversible?
Sorry?
ED? Erectile dysfunction?
Erectile dysfunction it can actually be in two forms. You can have an erectile dysfunction due to a vascular problem. Then if you have a vascular problem, you sort out the vascular problem. Sometimes you will reverse it by just sorting out the medical problem. But unfortunately, if it has gone too far, you might actually need to support it. Like diabetes and everything gets supportive treatment for a long time.
Okay. Yeah. I think that's all very interesting, and I like how you've emphasized, the age group, simply because of that myth that, it's not something we need to pay attention to as younger people. And the fact that you're highlighting a lot of chronic medical conditions really does emphasize that men's health is really extensive. You need to check yourself regularly and comprehensively. So if we could just maybe find out what people, this is a very interesting conversation, not only for us, but everybody else. So, and people have shared their questions and thoughts. And one of the questions that we received is trying to understand what is the difference between erectile dysfunction and early ejaculation.
Okay, erectile dysfunction, as we've defined it earlier, is when you struggle to get an erection, when you struggle to maintain an erection, or when you don't get an erection at all. People with premature ejaculation are people that can get an erection. It's a normal erection, it's a good quality erection, but the only problem with them is duration. They will have sex, but they do not have power to control when they can ejaculate. So before they want to ejaculate, or before they can please their partner, at that point they just ejaculate.
And it must really bring a lot of stress to the relationship, as a couple when ED is involved. So what are some of the ways in which you can assist your partner, maybe help them get aroused, and just, stimulate them?
Number one, we need to be very careful around that topic, because it brings that stigma that when there's erectile dysfunction, maybe the partner contributes in a way.
True.
Erectile dysfunction, like when your partner has diabetes, there's nothing the partner can do, but you can just support them to start treatment. You can support them to start treatment and get the condition treated. Yes, there's a lot you can do to assist in that way, in the sense that you must communicate. One thing I always say is that people that communicate about sexuality before there's an issue, they actually find it easier to raise issues when it happens later. Like if you are in a relationship, everything is going well, but you do talk about your sexual problem, the good sex that you have. When issues actually start, it becomes very easy to actually start communicate about that. So communication.
And obviously, we're looking at it now holistically, because sexuality for men is really key to their identity, masculinity. And what are some of the downside of, men who experience this? Psychologically, what are the mental health issues that they may experience as a result of ED?
Some are before, that may have an impact
Yes.
on erectile function, and some are what
As a
happens
result.
when now you have an issue.
Yeah, when people already have erectile dysfunction, it actually destroys men significantly. A lot of men tend to go to alcohol for support, some will go to drugs for support, and sometimes actually males will go out of their stable relationship, whatever, marriage and stuff, because there's that mentality that when there's an erectile dysfunction, you're just not attracted to your partner. You always look like the problem is outside, not within you. So they'll go out of the marriage to try and get sex somewhere else, and when they realize that actually they're trying a lot of different people but it's not improving, that's when people actually, that's where the downfall actually begins. I think if males can actually understand the fact that that's when you stand up and get help, and you can't be sorted than trying to sort out the issue.
That's actually being a man.
That's being
not
a
the
man,
other way around.
Yes,
Yes,
that's so true.
okay.
But like a lot of males with erectile dysfunction are depressed, and unfortunately, what happens is that they will be depressed because of the erectile dysfunction, even when the erectile. That's what I experience with most of my patients. When the erectile dysfunction is actually is sorted, the emotional trauma that they went through will actually continue beyond the medical condition being sorted. They will struggle to get erections because they were embarrassed so many times, they were insulted so many times for not getting an erection at that time. So a lot of males go into depression, alcohol, a lot of other depressing things because of erectile dysfunction.
Sure.
As we go viral, Doc, tell us, we're talking hepatitis now. Tell us the most common types of hepatitis, and tell us what we should look out for.
I certainly would say most B and C. So they are transmitted through blood. It's similar ways as, for instance, HIV. So because we have high burdens of HIV, we have high burdens of hepatitis B. Hepatitis C is very interesting in the general population because we're seeing it a lot in people who use drugs, especially people who inject drugs. And obviously this is a growing concern in our communities. And these two viruses, you don't know that you have them. You will live a long life until maybe 20 years down the line, your liver starts failing and you develop cancer of the liver because of these two viruses. And it's very unfortunate that one should get to that stage because, for instance, there's a vaccine to prevent hepatitis B. There's treatment to treat hepatitis B, though you can't cure hepatitis B. With hepatitis C, there is no vaccine, but it's 100% curable. There are treatments available for use, yeah.
Best times of vaccine?
So with hepatitis B, it's actually included in our immunization program for babies. So you get it earlier on, and then obviously for occupational reasons for adults maybe who are traveling, if you are in the health sector, you will get hepatitis B shot, but generally it's available to all babies.
What are the processes involved in just making sure I've got cover?
You need to screen and test for hepatitis B. We really advocate for people who are at potential risk. So fortunately, in all HIV programs, they regularly screen for everybody who's HIV positive. They screen for hepatitis B. So hepatitis C is very difficult given the communities it affects most of the time. I mean, for instance, people who are abusing substances, they rarely go and seek help. And that's where the struggle is. But really, you need to test first and screen to be able to be treated.
Okay, awesome. The public out there, you know what to look out for. Get screened for hepatitis A, B, and C, I suppose. Okay, before we let you go, Doc, we're gonna find out where we can find you. But before that, let's discuss the fun part of the episode, which is where we discuss the myths. So I have my own, and you've got a few, I'm sure. Okay, is it a myth or fact that in colloquial terms they say something, but there is a belief that sometimes your partner can stimulate you if there is erectile dysfunction? In colloquial terms, but is that a myth or a fact?
It's a myth. If you have erectile dysfunction and it's medical or whatever cause, it needs to be treated. It's not a matter of attraction. It's a matter of you have a condition that needs to be treated.
Dashing my hopes.
Sorry.
I don't like this. Myths of your own, Doc.
Erectile dysfunction is actually associated with long-term marriages. There is lack of attraction in the marriage. Absolutely not true, because it's usually associated with aging. It's actually the process, the normal process of aging. Males with age at 40, they'll start struggling, and it's associated with that. And the fact that when people get familiar with each other, the attraction will obviously go down a bit, but it will not cause erectile dysfunction.
So le ndaba yokuyolola ngaphandle ayikho.
No, ayikho,
I
but
I can't go out and sharpen my knife
No,
and
no,
come
no,
back
no.
home on fire.
No, not at all. But what will happen is that when you have a sexual encounter for the first time, there's always sparkle. So it might be better than where you were at home. But when you go back for the second time and third time, it will go down. You will go back to where you were. So akuloleki kahle.
So don't be fooled first time round.
No, don't be fooled first time round. And it has nothing to do with the partner. It's just you being excited over intention.
I'm not happy with the end of this episode, but it's fine. Tell me facts about erectile dysfunction.
Erectile dysfunction, most males, 1 in 3, will struggle with erectile dysfunction. So if someone out there is sitting at home, they're not getting their erections in the morning, they're struggling with certain things, they're not alone. They should know in their group of friends, there's another friend who's also going through the same thing. Number 2, erectile dysfunction, as you get older, at the age of 40, your testosterone levels become lower. So you might struggle with low libido and things like that. But erectile dysfunction is not low libido. Low libido is associated with low testosterone levels, which is not erectile dysfunction. So there's that myth as well of going out to get testosterone to boost your erection. Doesn't really work well, because the causes of erectile dysfunction that we mentioned, we did not mention low testosterone, because it will cause low libido versus erectile dysfunction.
Okay, Doc, I have to admit, I fell in love with your page. It's well presented.
Thank you.
It's very interesting, something different all the time. Keep doing what you do, and but please tell us where people can find you.
On Instagram, I'm the.blue.clinic, and on Facebook, I'm the Blue Clinic by Dr. Thabile. I just started a YouTube channel as well, the Blue Clinic by Dr. Thabile.
Okay, please try her Instagram page. That's the one I know. You will fall in love.
Thank you.
And
thank you.
from now on, she's also found on our website, which is askyourdoctors.co.za. Please go to the tab that says Find a Doctor. There you will find everyone else that has been on the show and that will still be on the show in the future. In case you think your brand aligns with our brand and you would like to see your brand on our platforms or be seen on our platforms, please use the link that's on the screen right now. Via email, we are close to nature, I did say, so we embrace it. Otherwise, just send us a DM on our social media pages, which could either be on Facebook or Instagram. Is there anything you would like to add, Doc?
No, but I'd like to end off, with the wind and everything. You literally blew us away. So thank you. It was such a great experience having you.
I enjoyed being here. Thank you.
All right.
I think we enjoy both Devon and you.
Yeah.
Until next time, guys, keep asking your doctors.